Good afternoon, everybody, and welcome to today's meeting of the Children and Families Overview and Scrutiny Committee. As usual, this meeting is being broadcast live to the public. For those not able to watch live, the webcast will be recorded and made available for viewing on the County Council's website after the meeting. Before we begin, can I please remind everybody to only turn on their microphones when you wish or are invited to speak. Thank you. We move on to the agenda. The first item on today's agenda is the minutes of the meeting held on the 7th of June. I move that these are taken as read, confirmed and signed. Is everyone in agreement? Agreed. Thank you. Item 2 is question time. I have received a question from Miss Karen Reardon, who is present in the meeting. Would you like to come forward, Miss Reardon? Thank you. The question and its response have been circulated to members of the committee prior to the start of this meeting and will be taken as read. I would like to remind members that no discussion is to be held on these. I will now invite Ms. O'Riordan to ask a supplementary question if you have one, and I would remind you that your supplementary question should be to clarify the reply you have been given and should not raise any new issues. So if you would like to give your supplementary question.
I'm going to skip forward to the actual question itself. This is in the response to the audit of cases the local authority does at regular basis to learn from. Are these families contacted as part of the audit? Are their views heard and took on board? And should they not be included their children in the care system? Also in the audit is reviewed in the inclusion of impact of mental health with the separation between parents and children and young people. And that's the most damaging part for parents, children and young people. That's okay.
Is that your question?
That is the question I wanted to ask more so, yes.
All right. Thank you.
Thank you, Chair, and thank you, Karen. Yeah, the audits that we undertake, so we as a service regularly undertake thematic audits to look at the quality of work that we're delivering. The audits that we do are what we call warm audits, so they do along with speaking to our staff directly, we also speak as appropriate to the parents, carers and children as well. The parents and children involved are given the option of speaking to the auditors if they want to. Over the last 12 months of audits we've completed, 62% of children and families have contributed to those audits, and we absolutely take on board what they say. They're a really important part of the audit in terms of their feedback of the not just the work that we've done, but the impact that that's had on them as well. So we absolutely hear that, listen to that. We're also continuing looking at how we engage with children and parents in terms of our learning and future work. And we utilise this as well to feedback on our service design and improvement. In terms of considering the impact of mental health in relation to when we separate or have to separate children or young people from their parents, absolutely this would be something we would consider if the audit or indeed the assessment identified that as an issue. We would use the audit to understand whether there was any learning from that, whether there were any development needs for staff, or indeed whether there was any good practice in relation to how that was then managed.
Thank you. Thank you very much. I will now thank you, Ms. O'Riordan. You're now welcome to stay in the meeting, or you may leave if you wish. Thank you. Item 3 on the agenda, I've received no questions under Standing Order 7 from members. Item 4, I have no urgent items. Item 5, declarations of interest. Do any members have any interest that they wish to declare? No, thank you. Item 6, declarations of the party whip. Do members wish to declare the party whip? No, thank you. Item 7, I have not received any petitions, so therefore we're moving on to the first substantive item, which is a report on SEND and inclusion, starting at page 13 of the agenda pack. Excuse me. Alison Bradley, the Interim Assistant Director for Education and SEND, will present the item. Thank you very much, Alison.
Thank you. Yes, the paper, as states, it is an update on the SEND and inclusion work that we're doing in the department. The points 1 to 7 give the background and other reports that have been shared in the past to give some context to the further discussions on there. In point 8, you will see that despite all the continuous improvement that we've spoken about in the July update as well to members, the SEND system, there's still currently a financial challenge. The MTFS indicates that the deterioration and the in-year deficit has increased for the last 3 years, and the failure to deliver the savings is predicted to lead to a cumulative deficit in 25-26 from 63 million to 84 million. On point 9, the Department for Education have identified 9 local authorities to form part of the safety valve programme for those on the highest level of deficit in the dedicated schools grant. A further 55 the Department for Education have identified for less severe but still substantial deficits in the DSG have been identified, and Leicestershire are one of those authorities for the Delivering Better Values programme. We're currently working with the Department for Education on what this will actually involve, but it will form part of the work that is described later in this report around transforming SEND and inclusion. In points 10 to 13, it gives the report gives an update on the Leicestershire position. The demands in Leicestershire do remain very high in the local Leicestershire SEND system, which is consistently impacting on the financial deficit and the Children and Family Services ability to work through the demand, which is not allowing us to hit the statutory deadlines across all the related areas in the SEND Code of Practice. In not hitting those statutory deadlines as set out in the Code of Practice, which is raised in point 12, this is leading to an extreme level of dissatisfaction across the sector, and that increase in complaints that we are receiving, which is creating additional demands upon the service. Additionally, there are also an increasing number of appeals against decisions being made, which often lead to those cases being seen at tribunal and then court overturning the decisions made by the local authority, which creates additional work within the system and service. On point 13, the details around the service continuous improvement in the system are highlighted in there. For example, the SENA new system, data management system, which has been in place called Synergy, is put into there, and the SEND sufficiency, along with the work around with our change partners to work on the transforming SEND and inclusion. And we're commonly referring to that as the TISL programme, but the fuller version is the Transforming SEND and Inclusion. The department is working on the new phase of transforming with the change partners and builds on the work that has taken place along the high needs BOP previously. The approach that is taking place, which is detailed in points 14 and 15, is focusing on the whole of the SEND and inclusion system and will work with the wider stakeholders to take this forward. In point 15, this highlights that the work will build on the diagnostic work that was undertaken by the change partners at the end of 2021 and highlights the work that needs to start and form part of transforming SEND and inclusion as we move forward. In point 16, the Transforming Send and Inclusion programme highlights that there will be 4 work streams that the work will focus on as a wider stakeholder and department moving forward, and they'll be detailed through the decision making and ways of working, which will be system transformation. Inclusive practice, again, that will be system transformation, and the digital and performance, and the communication and engagement across the whole of the stakeholder sector. Point 17 summarises to say that the success of this work really will depend on the enablers highlighted in the summary of the document, and that will be in high level the belief in change, the shared vision with all partners to get the right support at the right time. It's a high level summary of the report shared.
Thank you very much. Mrs. Taylor, did you want to come back at this stage about anything?
No, Chair, I'm happy to go to questions. Thank you.
Thank you. Well, we're going to questions. I do have one, and I shall take Chairman's prerogative and ask mine first this time. I normally go to everybody else. I'd like to refer you to page 14, paragraph 11, under Leicestershire position, and that is about the huge difference in percentages between us at 54% since 2016, an increase of number of children and young people on education, health and care plans. In England, it was 38% in the same period. And in the East Midlands, which is our basket, councils, it was 32%. I could understand if it was a few percent different, maybe up to 5-6%, but 20% is a lot. So, and I think I would like an answer. I'm sure there isn't an answer that will clear it all, but an explanation, shall I say. Thank you. And we're moving to you, Jane. Thank you.
Yeah, thank you, Chair. Yes, the figures are stark in terms of the difference of our growth compared to other local authorities. And as you can see, you know, as you set out, the difference is 20% in terms of our growth. I think, as we've set out in the paper, we need to understand that more, and I think there will be multiple reasons for that. There won't be a single issue reason, and part of us moving into the programme, as Alison set out, is for us to really understand why our numbers are higher, but equally what we need to be doing to get it right for children. So if I just point you to paragraph 15, we set out, or part of the diagnostic, or what we were told, pointed to 2 areas which I think partly answer the question, but I think as we've set out, we really do need to better understand it. So there is something about our mainstream schools and how enabled they are to keep children there in order to meet their needs. And then secondly is a better understanding of those key drivers in the system that are increasing demand, which in turn are leading to the pressures. So I think in summary, at the moment, we need to work harder on really understanding what that's about, and that's part of the reason why we're entering into this programme.
Thank you. Any questions? Yes, Mr. Smith.
Thank you, Chair, and thank you for the report. And mine refers to paragraph 12, so it's also almost a follow-on to Mrs. Fryer's. Obviously, there's a massive increase in the appeal procedure, and it takes up a lot of officer time and resources. Clearly, we need a more robust procedures in place. What can we do to stop them getting to tribunal in the first place? Thank you.
I'll pick it first, and Alison may add. You're right. I think the system at the moment is incredibly complex, and actually, you know, at the bottom of the end of the day, really difficult for our children and their families as well. What we're seeing is many issues going to appeal. So if, for example, the service decides that that it doesn't require an assessment, often that goes to appeal or to tribunal. If a placement is given and it's not necessarily what the parent or carer want for their children, it will go to appeal. So really, really difficult. And obviously the time it takes, both for parents and carers, as well as our staff, to deal with appeals is something of a challenge for us. I think there's more work we can do around working earlier on in the system to make sure that we get it right. And one of the key themes across this paper is that our ambition is to get things right for children at the right time, in the right place, and with the right support. And I think some of that work should help us to avoid the appeals process. Nevertheless, all of this is driven by a statute, the Code of Practice, which does set out certain things that we've got to do, and we need to make sure that we continue to be compliant with that Code of Practice because it's set out to support children and their families. And so inevitably there will be disagreements within that system, which means we'll go to appeal. But there is more work we can do, and again, some of it's set out that we need to do to get better at doing that.
Mrs. Taylor?
Yeah, I just want to add to probably that and your question as well. It is the issue of funding. We all know that Leicestershire is one of the lowest funding county councils, but our schools are also quite lowly funded as well. And if the schools were funded much better, they would be able to be a lot more inclusive because they would have the funding to do that. So I think there's a knock on children, and the main thing we need to do for children is keep them in mainstream school. That's the best place for them within their community. So I think funding is a real issue as well within this.
Yes, I'll come to you. And then I think Mr. Martin. Yes, if I could go.
It's just to reinforce the comments that have just been made by Mrs. Taylor and Jane there, is one of the key themes that we do see through is relationship management. So the information management system that we have in the Synergy portal system, it is about having that close communication. So I would hope to see some changes as we move through, not only through that volume decreasing or the appropriate support at the right time for children, but that closer engagement at the right time, I think, would mitigate some of the angst that is in there through the system. So hopefully that would make some changes.
Mr. Martin.
Thank you, Chair. I've got quite a few points from 12 to 15. Do you want me to go point by point or do them all in one? All in one. First, just to give a comment on number 11, I would actually congratulate Senna on having more EHCPs for our children. I understand the burden that creates on Senna, but it also means that you are providing the correct care for disabled children. So seeing a larger increase in the educational health and care plans, for me personally, as a school governor of a SEND school and parent care, I see that as an excellent thing. Maybe some people see it slightly different. Number 12, I really thank you for being honest about the current situation. I think the understanding of how difficult this situation is something that the communication that parents have, and therefore sometimes they complain more because they don't actually understand how much stress the situation, the system is under. So the fact that number 12 was actually really quite frank about the statutory duties, not being fulfilled, I'd just like to thank you for the honesty of that. And I think that parents would take that on board if that was communicated to them more and maybe understand a little bit more. Just 2 points. So the tribunals, the statistics state that most tribunals are overturned. The first question would be, when the same things are going to tribunal over and over again and being lost over and over again, why are they getting to overturned? And obviously that creates a lot of time for parents, a lot of time for the local authority. Tribunals aren't cheap. I think there was a freedom of information request recently on how much it costs. And then secondly, on phase transfers, thank you for providing the information from a question at the last meeting. I'd just like to see, obviously there was a few hundred children still without places. Just like to confirm that all of them are in school now with the school term starting. Obviously there's a big backlog, and hopefully for next year, the TISL programme and everything might help with that. Moving on to number 13, the Synergy project. A lot of families in Leicestershire are blended families. People have complex situations. You've got special guardian orders. You've got family members taking care of children. How are you going to manage with that system? Data protection, who's allowed access to what? Because obviously when it's an email to a direct person, it's end to end, isn't it? Which means that you instantly get around that. A system sounds brilliant, but access to that system, some pretty complex situations with children, how are we going to get over that? That'd be another question. The 94 spaces that we've created, I think that's brilliant, but how does that compare to demand for these spaces? And then just 2 more. we're going to be trying to get the views of children in Leicestershire, and I sort of worry sometimes we get the views of children that can easily communicate, and a lot of our disabled children are more profoundly disabled. And the reality is that there are some absolutely excellent work going on in our area, special schools, and a lot of the things I can comment on in a negative light, but some things I can comment on in an excellent light. And I really would like you to think about, maybe with speech and language therapists, special schools, how we get the views of the more profoundly disabled children in this programme going forward. And just the working with schools thing in point 15, as a school governor, I understand the financial pressures that are going on from the school end, and I think that was just mentioned. I can't remember who just mentioned it. This sort of working together with them to allow them to be more inclusive, which is obviously what we all want to, early intervention, to help people before they get to the local authority stage. How are we going to do that with absolutely huge financial demands on schools where, the first things to go are normally these sorts of schemes that we're talking about? I know that's quite a lot. I'll try and be quiet for the rest of the day. No worries, thank you.
Okay, thank you. I think I wrote all of them down. So just in terms of your first point, yeah, I think the really good thing is that children's needs are being identified. You're absolutely right. I think what we need to get better at in Leicestershire is not relying solely on EHCPs to make sure that happens. And I think that would be our comment around the numbers, is that actually we ought to be able to be meeting children's needs without having to go through the lengthy EHCP process for some children, and therefore those that then need it would have an EHCP. But I mean, I think your point is right. We need to be making sure we're identifying children's needs and doing what we can to meet them. The point around the frankness and honesty around the situation, thank you. We do recognise it, and I think it is really important for our parents, carers and children for us to absolutely appreciate that the current situation with the delays within the system is not good for them. We are dealing with every single case. We are processing every single case. We're doing it late at the moment. What would be really helpful, and I know we're talking to the Parent Carer Forum about this, is how best we communicate this so that we can reassure parents, as well as acknowledging it's not a great position for them to be in. We absolutely understand that, and we care. We genuinely care about the children we're working with, and don't want to be adding to distress or difficulties as well. The issue of tribunals is a really interesting one, and I think what I'd say is that we go to tribunal when we don't necessarily agree. So it was as in we don't necessarily agree with what the other person is proposing. So it would be really difficult for us to continually not go to tribunal. Part of us going is us putting forward our case, for example, around assessment or around a placement. So we are really careful about our assessment of need, our recommendations about whether an assessment's needed, or indeed where a child is placed. And where we don't agree with the parties, invariably the parent or carer, that's when we end up at tribunal. I think there's some consistent learning for us from tribunal, and some of that's about communication, some of that's about earlier working, so the things that Alison picked up as well. So I think your point is right. There's more we could do to understand what could prevent us from getting to tribunal, but there will invariably be many cases that do have to go to tribunal because, for example, we think the placement can meet need and the parent doesn't. And but I think your point's right. We could do some more learning, or certainly understanding from that. In terms of the phased transfers, we can get an update on numbers for you, unless when I hand over to Alison, she's able to give it. But I doubt we'll have it at the top of our head. But we'll definitely come back to you. In terms of the backlog, as you've stated, as we shared with members last time, and I know we briefed you on, because of the level of demand that came through kind of earlier last academic year, the Centre service is in essence kind of behind on processing assessments and reviews. So it isn't that we're not dealing with things, it's that we're dealing with things late. So, it's a really important message that things are not lost in the system, but we are processing them late, and we're looking at how we can kind of get up to date with that. We were absolutely intent on making sure that those children who required a school place had got them, or those children that were transferring, so we can give you an update on the numbers there as well. In terms of the synergy question, absolutely right. I mean, we're developing a new system that enables our parents and carers to access information directly, which we hope will mean that there'll be much easier access for information for parents. But you're right, with that it brings some complexities. I think we might need to get back to you on that around how we're managing it around the data protection, but it will be something that we've considered. And again, Alison may have an answer, but it might again be something that we need to come back to. The 94 places that you've pointed to are were absolutely needed. Part of the reason we put those in is because we had a cohort or number of children in the early years that were identified earlier on that we needed to find places for. But those 94 places are part of our wider SEND strategy around building and putting in the right places for the children in the right place. So it's part of an ongoing plan to continue to develop our provision locally in areas, not just geographically, but according to need that we need it most. So it certainly won't be the end of us putting in additional places. Those 94 was specifically about expanding some of our area special schools to meet a demand that we had there. The point around engaging children is so important, and you're absolutely right. We've got some outstanding and excellent special schools and specialist provision across the county, and I know our children would have so much to say about why that's good as well. I think we are doing a lot of work around how we engage the children, but I think your point's right about how we make sure we're hearing the voice of all children and really thinking carefully. So we will take that back to not just our services, but some conversations with schools as well about how we gather and garner some of that. And then your last point around working with schools around inclusion, and you know, as Mrs. Taylor set out, that the challenges within schools are significant, and funding does play a significant part in that. I don't believe any of our schools in Leicestershire don't want to be inclusive. I think they fundamentally believe in children and want to do the best for children, but the challenges are such that that's not always easy. Part of what we're proposing through this programme is working closely with schools to think about how best we can develop inclusion. Some of that might be about how we use funding differently. Some of it might be some other ways that we come up with. So I think we're really keen to have those conversations with schools to think about how we can best change the system for children as well. Alison, did you want to add anything?
Yeah, just to come in on that. And so the phase transfer, yes, I would have to come back with the updated question because it is still work we are working through. But as Jane was articulating, some of that demand that we have, backlog. I don't like to use the word backlog because it's the fact that the work is going through. The cases that where they haven't been placed will be to do with very complex and complicated reasons. Some of it might be to do with tribunal in there. So we are aware of that, but the vast majority did go through, and also that was a successful join up with our colleagues in transport to make sure that another delay that could have been incurred would have been the transport side of it. So I just wanted to add that kind of update bit into there, but we can come back with the actual numbers because they will be changing. And the synergy bit, some of the delay in getting what's called the gateway, the access to parents and carers and schools to do, has been to do with the GDPR pieces of work that you've spoken about, but the finer details of that, the complexities around blended families, different contacts who would have that, is quite right, but we can bring further updates onto that. The points that you raise about that 94 places on there, it does form part of the TISL, the Transforming SEND and Inclusion work as we move forward, because it will be about making sure that, you know, through making sure we've got the right reviews, making sure we've got the right priority of need for the young people, making sure that then we've got that right sufficiency in the system so it stacks up alongside that piece of work and a priority as well. That voice of the parent, absolutely, I totally agree with you, and you know, I have a background in working in specialist settings as well, and we do want to capture that voice through any aids that augment that communication and use the skills and expertise in the school setting. So that is really important, and again, that kind of priority that we have in part of the Transforming SEND and Inclusion is that engagement with the school sector and the early years sector to make sure that we've got that voice and that co-production of any work around the inclusion that we have moving forward.
Just very, thank you ever so much for all of that. I know it was a lot. Just very quickly on the phase transfer. Obviously, February is when we're meant to be sorting out the next ones. I'm a governor of a school that deals with phase from Memphis up into Thing, and I can just say really good things about what's happened at Lubbersthorpe. However late it was, parents have, saying some really great things. Just the delay was obviously an issue. How are we going to make sure, maybe not February, but a lot better next year than this year? Well, what's the sort of plan for that?
Sorry, I can respond to that very quickly on there. So indeed, yesterday we have held a whole service planning with the Centre Service Department to look at those priority needs, and again it will form part of the Transforming Centred Inclusion. So we've got the right milestones stacked up in terms of not dealing with it in a reactive way, dealing with it in a very proactive way as best we can, whilst getting the volume down in the system as well.
Thank you. Did I see that Ms. Lewis wanted to ask a question?
Thank you, Chair, and thank you for facilitating a hybrid joining. Alison, thank you for your report. It's really helpful. A couple of just observations as regards the current delays and backlogs. I think one of the most helpful things for parents and carers would be to know when you expect for this tricky position to be resolved, not just on an individual case basis, but when is the department expecting to be back to achieving statutory timeframes? Secondly, I wanted also to comment on point 15. I really am pleased to see the focus on inclusion in mainstream schools. I think it's actually really significant that we do everything we can to support children with additional needs to remain in mainstream settings where appropriate to do so. And finally, on 15, I just wanted to query the growing demand and number of requests for EHCPs. And I think there's some work to do there in picking apart actually a parent or carer on school isn't requesting an EHCP, they're requesting an assessment of a child's needs, which may or may not lead to the issuing of an education and healthcare plan. And I think that piece of work could be helpfully more developed so that schools and parents and carers understand that the local authority has a statutory duty to undertake an assessment if particular criteria are met. So I think that would be really helpful. They're my points. Thank you very much, Chair. And to reiterate, thanks to Alison for such a helpful report.
Thank you. Alison, do you want to come back?
Thank you, Carolyn. Yes, your point, 2 points I take. The first one is the that tricky position and how we're going to move closer towards hitting those statutory deadlines. It's not an easy one to answer, but the direction of travel will be with our change partners to actually have some milestones that we're working towards in the next few weeks, and we will be sharing that information out. We won't be hitting it as straight away. It will be a phased approach to do that, because the complexity of transforming SEND and inclusion will be looking to reduce that request just for an education and healthcare plan, but it won't be about reducing the need to meet the needs of children in the system with the right support at the right time, which leads me into your second part of that question there, the mainstream and the inclusion. And you're right, parents, carers, schools are requesting an assessment, and they're requesting that assessment of needs. So the work around the with the change partners in terms of transforming SEND and inclusion will have an emphasis and a focus on getting the right support at the right time. And it might not be through an education and healthcare plan, but it will be getting that specialist support at the right time for young people.
Thank you. Councillor Hunt.
Well, thank you, Chair. I thought this is a really good report. The problem is that it's covering such a huge canvas of what we do in this area. And so the questions that are coming forward, I'm having trouble keeping up with them all, to be honest. But it is worth spending some time on it. In particular, the two things that have come up so far are the question that you asked, Chair, about the percentage that we're getting through much higher than elsewhere, and I think the director said that we're going to do some serious work on that, and I think it would be well worth having a report back on that when that's available, along with the report refers to the, is it TSIL? Do we call it TSIL or TSIL? No, the new process that we're going through to see how better we can tackle the workload that we've got. I think those two things are probably what we want to hear about in due course when officers are in a better position. But my question's a technical one really about the MTFS position and the deficit that we're running up year on year. We're doing quite well at that, actually. Is there a penalty for the increasing deficit? It's a deficit on the direct schools grant, isn't it? Obviously, you know, it's not a good thing. Not saying that at all. But what is it costing us when, you know, when the deficit rises on an annual basis, as it seems to be doing? Thank you.
Thank you, Chair. I'll pick up the first bit, and then my colleague Jenny Lawrence is on the call who'll pick up the matters around the finances. In terms of the first point you've made, yeah, our intention is that we would bring back a regular reporting on this programme now. It's a major piece of work within the department, so we would want to be bringing back a report to not only report back on the outcomes in terms of our understanding, but also a programme update. So we will be bringing back regular reports to you on the TSIL programme. And I'll just hand over to Jenny, who'll just give an overview of the financial implications.
Okay, thank you, Jane. The treatment of dedicated schools grant deficits are the subject of much debate at the moment, and there has currently been a call for evidence from the government to actually look at how local authorities are managing them. Without going into too much technicality, there is what's called a temporary override to accounting regulations in terms of the deficit. That means in reality that it's an unfunded deficit that the county council carries. That said, it is still an overspend, and it is funding that the council has spent that it doesn't have. So the cost arises to the council purely as it stands at the minute, and a lack of a reduction in interest from any investments that we're able to make from cash balances. There's no penalty as such from the Department for Education from carrying that deficit. We are expecting some changes into the accounting regulations probably from 2023, but as yet that's unclear and will be informed by the data collection exercise that the government has just undertaken with all local authorities to see how deficits are being managed and also how they are expected to change over the foreseeable future. A response from Leicestershire has been submitted to be considered as within that evidence.
Right. Is it possible there might be an amnesty on because all county councils are running up deficits? Is it possible that we're looking forward to an amnesty, and if there was a action on it from central government to address these deficits, would we be in the range of things in the middle of the range of deficits that exist in county councils, or would we be high or low?
I think Jane will be able to answer that, but we are straying into wishful thinking at times, I think.
I think that is wishful thinking, Mr. Hunt. It would be brilliant if there was some such an amnesty. We have outlined in paragraph 9, the Department for Education are looking at this, and there are a number of schemes that they've put in place. So for those authorities with the biggest deficit in the not last financial year, the financial year before, they've moved into the safety valve programme, where there is some financial support, but but to move out of deficit. We're in the next tranche, so the 55 authorities. We've been entered into the Delivering Better Value programme, where the DfE are working with us on reducing our deficit. That won't come with money that will help pay off our deficit. It's really working on the things that we've set out in the paper with you around how we can bring our spend in line with grant. So the challenge we've got at the moment is that our spend is more than we get in the grant every year, and the deficit obviously is what then builds up year on year as we overspend. So at the moment there isn't, sorry, in answer to your point around where we sit amongst county councils, you're right, there's been numerous reports around the impact of the deficits and where we sit. I would estimate we kind of sit kind of middle top at the moment, but we're certainly not in safety valve territory.
Thank you. And I think that's been a very good discussion, and we've had lots of points raised, and I'm pleased to hear that it will come back to us in a future meeting, possibly picking up on particularly points that are being discussed in detail this afternoon. So I see no more hands, so everybody is happy, and we'll move on to item 9 on your agenda, which is a closure report for the Defining Children and Family Services for the Future programme, and it's on page 19 to 26. I think you're taking this one, are you, Sharon? You.
Yes, thank you, Chair and Committee. I'm going to introduce the report and then hand over to Nikki Collins, who's the strategic lead for transformation and change, and has been leading the Defining Children's programme for us. So Committee will recall that we've presented earlier reports on the work we were doing with our partner around defining children's services for the future, and the report before you recaps on some of that work and the outline of the programme, but also pleasingly talks about the success of the programme and our recommendation that we close phase 1. We are looking within the department, we're working hard on phase 2, but this is the actual part of the programme that was done with the delivery partner. So if I hand over to Nikki, she can take you through the report and we can both answer any questions.
Thank you. Chair, just an apology if my phone rings. I'm expecting an urgent call that can't be avoided, and if that happens, I'll hand back to Sharon. All council services face significant financial challenges in relation to the demand on funds of services. In response to these challenges, Children and Family Services commissioned a private consultant, Newton Euro, to work with us to understand and to define what the opportunities for change are. Broadly, 4 opportunities were identified, and these are outlined in the report, and led to the engagement of staff, children, parents and partners to develop new models of working. The paper sets out some of the detail in relation to the results of the programme and the outcomes, but I wanted to highlight that these led to new processes for helping children to be cared for in the right setting. It has led to avoiding case escalation in some cases, and helping children and young people with disabilities reach greater levels of independence, so a focus on supporting them to reach levels of independence. In addition to these improved outcomes, there were financial outcomes and reduced costs for the long terms. And these key performance indicators are monitored for sustainability through a programme governance board, which is chaired by our finance business partner and ultimately reports to a governance board chaired by Sharon and then by Jane Moore. So that is the summary in total. The financial benefits are set out in the paper as well, both annualised benefits and an indication of how that is profiled over time. The closure of the project is aligned with the closure of completion with the final strands of the programme, which we were struggling to achieve, but have achieved now in relation to the creation of performance reports, so that we have clear line of sight of sustainability, and where sustainability is struggling, how we can then step in to offer the right levels of support to our staff and our managers to address how services are delivered and what might be impacting on that sustainability. So those were the last areas of development which have now been achieved, which means we've reached the conclusion of the programme.
Thank you, Nikki. Did you want to come back, Sharon, or not at all?
No, Chair, I think that covers, the report covers the details, so happy to take any questions.
Thank you. Mrs. Taylor, did you want to come back?
Not at the moment, Chair, thank you.
Thank you. So have I got any questions or comments on the report? It was a very good report. Very interesting. No? Okay, thank you very much. Thank you, Nikki. We now move on to item 10, which is the Q1 2022-23 performance report. This is on page 27 to 34 of your agenda pack, and I have that Sharon and Alison are taking us through this. Thank you very much.
Thank you, Chair. I'll start and then hand over to Alison for the early years and education performance. So the report is a report that comes regularly to committee. It identifies the key performance indicators that we are measured against and report upon, and the report outlines in part 6 the 24 measures of the 24 measures rather that we report against, where the authority sits as being in the top quartile to the bottom quartile. I think paragraph 8 onwards take you through some of all those key performance indicators, where the authority sits and whether there's been an improvement or a slight decline, and also the appendix that's attached, where that puts us into a red, amber, green, and obviously the red issues are the ones that are of greatest focus for us. So before I come on to the red ones, just to say that in relation to point 11 onwards, I can report there is some very positive performance there. And I can report that we monitor within the department this performance on a monthly basis, realise there's some fluctuation on a monthly basis, but can provide detail if needed around the improving performance against all those indicators if the panel wishes to have the up-to-date picture. I'll focus on the two areas that are red and are areas that we have presented information to previous panels. So the first is outlined in section 9, which is the percentage of child protection conferences reviewed in timescale. That performance within this quarter had decreased, our performance had decreased. Expiration of that is around, or was around at the time, availability of IRO times. They're the independent chairs of those meetings, and some staffing issues that we had across business support arranging conferences and review conferences, and the pressures that we've talked about before around staffing in the social work teams. I can say that we are making a marked improvement in this area, and for the month of August only one review was out of time scale. So it's obviously a concern, it's obviously a focus, but I thought the committee would want to know the more current, up-to-date picture against that indicator. In point 10, percentage of children subject to a child protection plan for the second or subsequent time has been a focus of our work and a focus presented to this committee for a long time. We reduced the number of children a few years ago. It's fair to say that during the pandemic, this indicator number has increased. To put into some context, it's been an increased number across the region and with other authorities. It won't be a surprise that during a period of time in the country where families were under more pressure and probably not the same level of help and support available from extended family members at times and other professionals, led to an increase in numbers of children where there are second periods or subsequent periods of child protection planning. I can hopefully reassure the committee that we review all of these children. We have put processes in place to ensure that there are robust discussions between the safeguarding unit and social workers to make sure that we are not being risk averse for some of these children. And we are currently looking at a piece of work that links into national work that's looking at, for some older young people, a different type of plan rather than a child protection plan. So still a robust plan, still multi-agency working, but perhaps a realisation that for some of those older children, a period of time on a child protection register is plan rather, not a register, that's showing my age, plan is not the most productive way forward. So they are the key areas for me to describe, and again to say that in point 19, although this particular quarter saw a slight reduction in the number of cases to children and family wellbeing, want to raise that over the period of the pandemic, the number of families and children being worked by our targeted early help service has more than doubled than it was before, and has stayed at a relatively high level for the last 2 years. So I'll hand over to Alison to cover early years and education, and then I'm happy to take any questions.
Thanks, Sharon. Yeah, the second part of the report does detail those children in the early years sector and the school sector, and the reporting cycle being on that termly basis. So the first part being for the fee for early years entitlement to education for the summer term. So the 3-year-old fee, the take-up is just slightly down for the summer term compared to the spring term, but the 2-year-old data is just slightly up on there as well. In the summer term, those children attending provisions that were good or outstanding, that again is just slightly up compared to the spring term. So we're starting to see a slight sort of upward movement on there. Just generally to note that the data that's been provided previously has been data that's been heavily affected by the COVID restrictions, and those figures that we're presenting now are more getting in line with the pre-pandemic kind of levels. So that's, I thought, a useful piece of information to note on there. From points 29 onwards, it really is those related to the school part of the sector. So in point 29, we can see that those schools which are categorised by an Ofsted inspection as good or outstanding, again, just a slight rise there that we've got compared 91.6% in quarter one compared to 90.5% in quarter four. So we've just got some slight sort of changes to that. And again, it's the inspection coming back in new and full without restrictions being seen in the school sector. The secondary, there are no changes to be seen from quarter one since quarter two in 2022. From 31 onwards, it is more inclusion related focuses on there. So the elective home education, we do have an increase in quarter four, which has increased to quarter three. And point 32, the those who are in the education entitlement training, that follows the national, that follows the trend. So elective home education, it does follow the trend for those nationally going into elective home education. In Leicestershire, a little bit of analysis on there. So the experiences in part enforced by the learning at home through the lockdown, where some parents have chose to continue with that. Some hesitation around children returning back because of the restrictions and health related needs, and then some of those restrictions for families have continued and they've taken up the offer of elective home education. In point 35, the admissions, we've got 93% for that first time preference for the first time entry into admissions, which was the same as last year. Point 36, the secondary, we've got 84.8% on the preference, which is just a little bit down on last year, which was 89%. Exclusions, again, the exclusions remains very low for Leicestershire compared nationally. We remain within the first quartile on that. Suspensions, or was referred to as fixed term exclusions, we've got a 1.62, which is a little bit higher than the last quartile, but again, we are seeing children coming back after restrictions that were enforced through COVID. The assessment data will be brought to the next report around the outcomes of any examinations or statutory assessments as primary assessments, getting mixed up with special educational needs there. For those children not in education, employment and training, we've got 1.4% for quarter one at the end of June 22. That remains in quarter four and remains unchanged on that. Thank you.
Thank you very much. Mrs. Taylor.
Thank you, Chair. I just want to say, as lead member, I have really robust overview of the performance report regularly, and also challenge the team to make the improvements that we need. Just a couple of points I'd just like to pick up about their repeat child protection cases. I do have the data where it breaks down about when the last child protection case was, and you know that does make the difference. Some of them are a lot sort of over 2 years ago when they were last on a child protection case. So those ones are less concerning than the ones that are repeated within sort of 6 months to a year, where it sort of says the exit plan wasn't quite robust enough. So I do have strong overview of that. And I just want to take this opportunity to encourage parents and carers to take up their free education entitlement, because we want those numbers to be 100% in Leicestershire. You know, this is government funding that we get to put in for early years, and it's really important that these children are in the early years to socialise them and get them ready for school. And that tends also to pick up problems that we were talking about earlier with any SEND needs. That helps us to identify them early years and get them into the right provision and make sure we've got the right places for them going forward. So it's really important that we get that figure up. So please encourage all parents and carers to make sure they take up that free entitlement.
Thank you very much. I entirely agree with you, because I think the early years, if you don't get that right, and I think because a lot went going on during the pandemic, so now we're getting the next tranche through, and it is really important that they take up that for all reasons, sociability, mixing, everything. Mr. Hunt, you had your hand up.
On the point you just mentioned, Chair, we're looking forward to some family hub development which might address, perhaps we could have a comment on that. My overriding concern is on child protection, which was still in the red. And you know, as we all know, when things go disastrously wrong, which we hope they never will, there's a real pressure on the authority and its leaders. So I would thank Debbie in particular for the oversight she's given, and admire the work or the challenge that we have in the authority. It seemed to me that the child protection problems we've got on the reds here, if you put it that way, might be to do with the lack of social workers. Have we got problems, particularly in the staffing in that area?
Jane, you want to come back, and then Sharon?
Yeah, I'll just pick up the point around the family hubs. Yeah, we'd be really pleased to come back with an overview report around the family hubs position in Leicestershire. As you know, or members may be aware, across the East Midlands region, we are working with our colleagues to develop a plan. So we'd be happy to come back with a full report there. Thank you.
Sharon, you wanted to come back?
Yeah, just in relation to the comments about social workers, we do have challenges around qualified social workers. Our recruitment and retention strategy has been shared and discussed here. So along with a national issue, we do have some challenges. We do, as a commitment, fill vacancies with agency staff. That in itself is a challenge at the moment with the availability of agency staff. But just to reassure on those figures, these are children that have been identified and are subject to a child protection plan. There is no, our figures and our performance against investigations, identifying need for children, assessment, and where appropriate, those children becoming subject to a child protection plan, our performance is actually very strong in respect of those children. This is about the review meeting, so it's not about the children being visited, it's not about the work being done with the child, it's about that multi-agency review meeting, which is important, and I don't underestimate its importance. But and just to reassure, those that are out of time scale have taken place. It's that they may have been slightly late for the review meeting, but that isn't the work that's being done with the children. But it is fair to say that across the country we're seeing challenges around qualified staff, qualified social workers being available.
Thank you. I have Mr. Walsh and then Mr. Hill.
Was the implication that during the pandemic the number of homeschooled children has been increasing, and what sort of scale is that at?
The numbers have increased since we've had the lockdown, and that's one of the factors that is being picked out as a possibility, that families are choosing to do that as we're moving back into normal times in terms of providing education face-to-face in schools. It's not the only factor, though.
Come back. Does that give the department concerns, and what was the nature of those concerns?
I think any children who are not kind of attached to a school would cause us some concern, although there are many parents who electively home educate their children and do so really well and really safely. What we know is that over the pandemic, or following the pandemic, we saw an increase in parents who chose to educate their children at home. Now, some of that could have been because the experience of the pandemic showed them that they could do it and they wanted to do it. However, there are a number of children who haven't returned to school for different reasons. Some of that's anxiety, some of that's around kind of other issues. What we know is that this isn't a Leicestershire issue, this is a national issue, and indeed there's been a number of reports to kind of escalate it nationally as a growing concern. We know who the children are who are electively home educated, and as a local authority we have a duty to visit those children, and if we are concerned about those children then we can take whatever action necessary as well, and again it's something we're keeping an eye on. We're really fortunate in Leicestershire, we do have an inclusion service who is proactively working with children to support them back into school, but we're also able to kind of monitor. But the bottom line is parents can choose to educate their children at home, and actually it's an option alongside sending their child to school that they're entitled to take. I am concerned that numbers are increasing, and would want to kind of understand that more. And we're seeing it post-pandemic, which I think nationally is recognised as something that is for us to have a kind of deeper look at.
Can I just come back in as well, that the part of the inclusion service is when any family elect to have their child electively home educated, there is a question and a period of opportunity that's taken to say, do you realise what that expectation actually means? Because some families may or may not have taken up the offer, and particularly those families who've been through the pandemic period might think that education is still delivered to them at home from the school that they were on the roll of. So we are doing a lot of work to manage that expectation, but the numbers being really high is a concern. But in terms of the question that you asked around, is that causing a concern? It's causing a concern in terms of those families who haven't understood the complexity of it, but then they choose not to continue with elective home education and they continue to work in the school. But it is a high number that does cause the concern.
Oh, there we go, perfect. Thank you, Chair. Thank you for putting this report together. Not to dwell on the negative, but I was going to ask another question about the child protection case reviewed within the timescales, because unfortunately we are going away from where we want to go, aren't we? And it's quite a big drop, 10%. I think the other stats had figures with them, so just looking for a bit of perspective, how many cases are we actually talking about here that were and weren't met within the timescales? And also, do you have any idea? I think you said earlier, you are meeting them, just not quite in the right timescale. So how far behind are we? And that was my first question. And then if I can have a follow up after, if that's okay.
Yeah, I can. I haven't got the exact figures in front of me. We are presented with those figures, so I can let the committee have those figures. Out of our numbers of children on a plan, I can say that actually it doesn't take a high number of children for that percentage, but rather than me give an approximate percentage, I'll get that information and send it through to you.
And that's what I suspected it might have been, to see such a big change in the percentages, actually, obviously, when you're not dealing with many people. My second question was about the free education entitlement as well. I mean, Mrs. Taylor said, she wants 100% to be those figures. What's the department doing to promote that to young parents?
So we use a variety of media platforms to do that, and we also use officers across the department who have closer contact sometimes with families to remind them of that opportunity that they've got to take up the fee. We have put some information around members to make sure that they push that out into their own areas as well. So we're constantly reviewing that. It's not a one solution has fixed it. We do come back to it, and we do look at other opportunities to push and communicate that message out.
Mr. Martin.
So in terms of the numbers and the data, I would come back to you with that outside of this meeting. We can come back to you with that. But as Mrs. Taylor was saying, we do take regular reports to our lead member in terms of scrutinising each separate category of being out of education. As you quite rightly say, Mr. Martin, it could be for exclusion related reasons. It could be children with medical needs. It could be non-attending through a school anxiety related route on there. So the way in which that support is given is dependent on whatever the circumstances are with that. So in answer to your question, I can come back with the data to that, but the actual approach on there is dependent on whatever the need is.
I see no more hands, so we'll move on to the final item on the agenda, which is the annual report of the Leicestershire and Rutland Safeguarding Children's Partnership, which is pages 35 to 54 of your agenda packs. Jane, are you presenting this? And do we have Mr. Fox with us? Oh yes, there he is. Nice to see you. Okay, I'll hand over to you, James. To Jane and then to James.
Yes, thank you, Chair. I'll take you through the report, and I'm joined by my colleague James Fox, who'll be able to support questions as well. So the purpose of this report is to seek views from the committee on the draft annual report of the Leicestershire and Rutland Safeguarding Children Partnership for 21-22. The purpose of this report is around assessing the impact of the work undertaken last year by on the safeguarding outcomes for children in Leicestershire. The report also includes Rutland because the Safeguarding Children's Partnership covers both Leicestershire and Rutland, and it evaluates the performance against the priorities that we set out to achieve in the business plan in 21-22. We've appended the draft annual report for this report, and I'll go through in a little bit more detail some of that. The report outlines the learning, the assurance, the training and improvement activity that the partnership and its partners have undertaken, and also the impact that this has had on safeguarding our children. Some of the key messages from the partnership, specifically in relation to Leicestershire, are that the partners and managers and staff are working well together to safeguard children. The partnership's responded really well to some of the emerging risks, such as safeguarding babies, and I'll talk a bit more about that. We know that there's more work to do in order for the partnership to really understand how we safeguard children from diverse backgrounds, and there also remains some improvement in how we listen to children and include the voice and lived experience of children, particularly where there's domestic abuse involved in the household. And we've worked on improving our engagement with schools, and also considered how we respond to some of the national developments as well. So in terms of the report, the priorities for the partnership are summarised on page 2, as well as setting out the work that's been done against each of those priorities as well. And those priorities were around COVID-19 response, our safeguarding babies, child mental health and emotional wellbeing, domestic abuse and child safeguarding, and safeguarding children from diverse backgrounds. And the report then sets out how the Safeguarding Children's Partnership seeks assurance through a number of ways. And again, we've given quite a lot of detail about how we work across the partnership, to seek assurance around safeguarding. So utilising performance data, we undertake a self-assessment and ask partners to. We undertake audits, we complete school surveys, and we do a number of other assurance work as well. And again, we've detailed that in the annual report. If I can just take you to page 9 of the report, page 47 of your packs, we've detailed some of the work around child safeguarding practice reviews as well. And these reviews are to help us identify how we can improve our safeguarding responses in the future. And you can see that the partnership has carried out 6 rapid reviews following a serious incident notification, and also considered 2 further referrals for review during the period of the report that you've got in front of you. And the partnership was able to identify learning to improve safeguarding systems from 5 of the 6 rapid reviews. And again, on page 48, we've identified a number of areas for further work as a result of those reviews. And some of those are around how we respond to parents with who have chaotic lifestyles or a number of complex needs. Really understanding the impact of modern slavery, both on adults and on children's lived experience. Looked at information sharing between health agencies, and again, we've identified some areas where we particularly need to focus. We've identified some learning about recognising the impact of parents with learning difficulties, or on parents who are responding, who have additional support needs, and some action around how we can improve the confidence of our staff in responding to potential fabricated and induced illness, and then a number of other actions around working across all agencies to identify neglect and continue to identify neglect, and then again some responses to bruises or marks on pre-mobile babies, And again, finally, one of the other learnings was around how we promote messages around the safe use of bath seats for babies as well. And then final bit to bring to your attention is the section on how we get feedback from children and young people and how we've used that to inform our practice and indeed service provision as well. So the report is being brought to you for your consideration and also to make any comments or proposed additions or amendments to the report that can be addressed prior to that report being finally published. Thank you.
Thank you, Jane. When you say any suggestions or comments we'd like to make, rather than go through it all in a meeting when people may not have digested it all, would you like them to send their suggestions, amendments to yourself and copy in the lead member?
Yes, happy to
Would
take
that
comments
be helpful?
directly. Yes, thank you.
Deborah, is that all right with you, so that you know what's happening? I think rather than everybody say, well, I'd like to change paragraph, what's it, and add this and that, it might be easier if, would you like a time scale on that, Jane? Would you like to say 2 weeks or week or?
James will be able to advise on that when he comes back.
Right, I'll pass to you, James.
Yeah, thank you, Chair. 2 weeks would be good, so by the 20th of September.
Has everybody noted that for you to go through your homework? Check.
Circulate everybody with instructions so we don't get it wrong.
It will be in the minutes, but I think basically
review.
Any comments or additions or anything to do with this draft report, could you get them to Jane, James and Deborah by the 20th of September? Have I got that right? Thank you. Any quick comments they would like to make now? Mr. Hajaniko.
Can we ask questions on?
Oh, yes.
Thank you.
Yes. No, this is
right. I have two questions. Question number one is about page 50. It is actually a bit of uncomfortable reading there. The more detailed finding of the consultations were communication with young people could be better. Many fellow professionals seem judgmental and did not understand what they had been through. And the next paragraph says many young people had to wait a long time for support, and meanwhile they developed their own coping strategies which were not always healthy. This is very uncomfortable reading, isn't it? Now, it is the observation of many of us that there is an epidemic of mental health problem, in particular among young teenagers. And from my experience, actually, yes, there is support out there. But it is a process. It takes, you take actually it takes the child to go seek help, to ask for help. Sometimes the help is remote. And of course, if Tesco's is 20 miles away, all right, you may go to the local shop or you may not even actually bother to go to the shop altogether. Now, what I'm trying to say here is actually there are too many children. Many children may have mental health problems, but actually they are afraid to seek help. Now, is any consideration actually just to put help actually in the schools, or where actually you are going to have actually professional psychologists to be actually in close distance and they have an office somewhere where the child can go there and say, I need your help, instead of following different mechanisms where actually the child will be referred actually to Loughborough Hospital, to a professional psychologist, which is a big process. This is question number one. My second question is about babies, the well-being of babies. It is in all over the report, well-being of babies, which is extremely important. And I agree, I mean, one case is too much. However, what is the scale of the problem? Do we have any statistics? Is the problem getting worse? How do we compare with other areas? Thank you.
Thank you. I'll pick up the first question and I'll just clarify your second question. Just in terms of the points you made, it does make uncomfortable reading. And I think when we hear the voice of children, it doesn't always make for comfortable reading, but it's really important that we do seek the voice of children and young people. And what we've outlined in here is the detailed findings of that consultation and certainly what we learned. And it does make for uncomfortable reading in terms of support and also how it left them feeling. Just for clarity, the work that we've reported here at the top of page 50 is the interview of children whose parents were considered as part of their domestic abuse involvement. So these children were not identified as having specific mental health issues. They were interviewed because they were children of parents who had been involved in domestic abuse. Nevertheless, it does lead to some questions around how we best support young people who are involved in, quite frankly, traumatic incidents, but also how we support the mental health of children. So I agree, it does make for uncomfortable reading. The important bit is what we learn from it and how we then kind of organise our services. In terms of mental health support, there is a whole raft of new and existing support, not just around schools, but out in the community and certainly within the department. You're right, supporting schools is one of the best places for young people because they access it. Over the last year, it was kind of post-pandemic work. The government did give some additional funding for mental health support in schools, and indeed we've rolled that out in Leicestershire, both in terms of training for school staff, but also the putting people into school to seek referrals. We've also got more kind of low-level support that children can access at any time through our kind of online services as well. But it's an area that we remain concerned about in how we best support children with mental health issues. In terms of the question around babies, were you referring specifically to the issue raised around babies and baths, or perhaps I wasn't clear?
No, generally, I'm talking about babies. How do we monitor actually the harm on babies, bruise on babies, abuse on babies? Is this actually, what is the scale of the problem? Is it, we have 2 cases, 20 cases, 50 cases, and how do we compare with other places? If it is actually a big scale problem, have we analyzed it properly?
Yeah, if I take that question, and James, I'm sure will come in with some general information on the national picture. So in relation to babies, just to reassure that the Safeguarding Partnership scrutinises the work with all children, but does look very clearly and very carefully at our work with pregnant mums and also very newborn babies. And we know from evidence, research, and I'm sure nobody would dispute that children under the age of 1 are some of our most vulnerable children. So there has been an increase nationally in the numbers of babies that were hurt or harmed during the COVID period. And that has been subject to a review by the national panel to look at learning from that group and those findings. And I think it's fair to say that some of the indicators and some of the causes around that were around parents feeling very isolated during COVID. They didn't have the support networks from extended family and from others, and for a period of time weren't getting the same visits from midwives and health visitors. So some of those issues were identified very early on in the pandemic nationally, and work has been done, and we have been involved in that learning across from national research. In relation to Leicestershire and Rutland, because our case review meeting, the multi-agency meeting that I chair is for Leicestershire and Rutland, we are only talking about a handful of situations, but actually we would want to protect, and one baby that is armed is one baby too many. So when I say it's a small number, to give reassurance on numbers, I wouldn't want you to think that we believe that that small number doesn't still have some significance, and we want to work really hard and hold our colleagues in health around midwifery and health visiting to account for making sure that the support to those children is as robust as it needs to be. And the learning that has taken place from any reviews that have taken place for Leicestershire and Rutland. Fortunately, for most of those babies, the baby has survived, that the incident and the circumstances have been explored, and we've looked at improving procedures and processes for both pregnant, pre-birth, for pregnant mums, and also for children in those early ages. There has sadly been young babies who have not survived, and those circumstances are rigorously reviewed as to whether they are circumstances that are so unique that, though we obviously take that situation seriously and want to learn, there is nothing that anybody could have done differently to prevent that set of circumstances, as opposed to any circumstances where we feel there is particular learning. And that's learning right across, from midwifery, from health visiting services, for any involvement from our targeted early help services or social care, and also from adult services, because quite often parents have, there may be mental health issues, there may be parental substance misuse issues. So the discussion and the learning is really rigorous across all services. James, I don't know whether there's anything you want to add.
Yeah, I can do, Chair, if that's okay. I think Sharon's mentioned the national review that was carried out, and really, I think, really highlighting that the national panel, a national child safeguarding practice review panel that oversees, I guess, the work, the multi-agency child safeguarding practice reviews across the country, had identified this as an area they were seeing in a number of areas, and certainly it's something that we've picked up in terms of a lot of the work that we're doing that's outlined in the report, to try and identify some of the issues and what we can do as partners to work together to identify concerns and respond to them as soon as possible to prevent any concerns or issues. In terms of our reviews, so if it's helpful, the annual report identifies that we had 8 referrals last year for child safeguarding practice reviews. Generally, those referrals are a case where a child has been seriously harmed or has died, and they're known to services and known to child protection and safeguarding. And of those 8 referrals, actually 5 of those related to children under 1 year old. So a significant proportion of that number, but that's kind of the numbers that we're talking about in a year. And as I guess the numbers in the annual report shows, that is higher than the number of referrals we've had in previous years as well, but certainly an area that we're looking into. We're doing work. I think from those we've got a lot of work looking at how we work together, how we respond to when we're aware of issues, the procedures that we put in place, and how we work together before a child's born, after a child's born, where there are concerns around that as well. And those will continue. And certainly in the current year, we're halfway through this kind of current year, 2022-2023, and at the moment we have, excuse me, we've had two referrals come through for child safeguarding practice reviews, one of which relates to a child under 1 as well. So that I guess I hope that gives an idea of the numbers, but certainly something that we continue to look at, respond to, identify what we can learn and how we can improve how we work together through our review processes.
I think we can be assured that, as you say, any one case is one too many, but we are doing as very, very best we can, and quite robust. So I don't see any other hands coming up, and I don't know if the officers or Deborah would like to say anything before I move on to close the meeting? No? Okay, well, I'd like to thank you all very much for attending. Our next meeting is on the 8th of November and at same time, same place. So thank you. Thank you very much.